I'm Christy with UT Southwestern. Thanks for joining our Facebook chat about concussions today. We're here with Drs. Cullum and Dr. Vargas. And Dr. Cullum is a clinical neuropsychologist who specializes in cognitive disorders. He is the Pam Blumenthal Distinguished Professor in Clinical Psychology, Chief of the Division of Psychology, and Director of Neuropsychology Program at UT Southwestern. Dr. Vargas is an Associate Professor in the Department of Neurology and Neurotherapeutics, as well as the Director of UT Southwestern's Sports Neurology and Concussion Program and the Sports Neurology Fellowship Program. So that's a mouthful. You guys have a lot of credentials. But as usual, please don't forget to like and share the conversation and share your questions in the comment section of the stream, and we'll take as many as we can get to. So the first question I have for both of you is, what happens when a concussion occurs?
Sure, I can take that one. It's actually a really complex process when a concussion occurs, and that's really a testament to the fact that so many things can happen symptom-wise in concussion. A lot of times what we can see is some changes that are not just structural within the brain at a level that's at a cellular level, and some changes in the metabolics of those cells as well. And that's exactly why when people want to get a head CT or an MRI, that's why frequently you don't see it, is because it's at that tiny, minute level. But if you think about concussion as a disruption of those normal signals and that normal metabolism, that's how we conceptualize it at the moment. The other things that happen are some changes like a decrease in blood flow, which is providing nutrients to those cells as they desperately try hard to become normal again. And that's why there's a window of vulnerability where if people don't recognize they have a concussion, they're susceptible to more injuries.
So, you talk about being susceptible to injuries. We have a question from Kristen here, and she's asking what protocols are currently in place to protect athletes from sustaining concussions?
Well, there have been a number of rule changes and equipment changes across sports, really, in the last certainly 5 years, for sure. All states have concussion laws now that require removal of especially youth athletes from competitive play. They have to be cleared typically by a physician prior to return to play, and is usually kept out for a week. Rule changes have occurred, moving up the kickoff line even in the NFL. They're working on new helmet designs in football. I think concussion awareness, though, is a big preventative movement as well, as people are more attuned to it and more able to recognize it in symptoms in themselves as well as in their peers. What we try to tell our athletes and student athletes, professionals as well, is that if they're not at their best, they can't be maximally helpful to the team. So we encourage them to report also.
That makes a lot of sense. And you talk about recognizing symptoms. What are some of those symptoms for people that might not know?
Well, the most common symptom is going to be headache. And a very close number 2 is going to be dizziness. And the funny thing about dizziness is that that's a very nondescript word. So we like to think of it as meaning several things, including imbalance, including lightheadedness, including just a feeling of not being quite right. A lot of that can encompass dizziness. But then there's a lot of other things that are a little bit more subtle that that a lot of people actually don't recognize, and that can include some mood changes or some disruptions in sleep. I think a fair number of people with concussion will also have some cognitive problems as well, where they're just foggy or they're just not able to think as clearly as they normally do.
So does the dizziness and the headache always go hand in hand, or if someone has a headache or when in doubt, should they just go ahead and get checked? Or how can you kind of differentiate normal, headache or normal post-workout dizziness? I don't know if that's ever normal, but how can you kind of know if they should see a doctor or not?
Well, I'd say that headache disorders are very common in the general population anyway. I mean, if we think about 1 in 4 households in America, nearly 1 billion people in the world have migraine alone, and that's just one type of headache disorder. And headache disorders are just as common in athletes. So the issue is really, are they experiencing something different? And is there a mechanism that can explain that difference, right? So if they actually have an injury on the field and it produces a direct result of a headache that is new or different or just not quite right for them, that's certainly something that's concerning. And a lot of how we differentiate that is just based on the history that they give us, doing a very good physical exam, and maybe one of the more important things is really knowing the athlete well.
So what are some of the risks if someone, fails to get checked out by a doctor when they do have a concussion?
I think that the biggest risk, as Dr. Vargas mentioned, is we want to make sure that if somebody is concussed, that they are removed from play, if you will, and kept from some of those activities that might induce a second concussion, because you don't want a second concussion until the brain, well, you don't want a second concussion at all, but you don't want a second concussion until after the brain is recovered from the first one. I think that's the biggest risk.
And Mindy has a question now that's kind of associated with that. She asks, how long should a parent be concerned with the symptoms of a concussion after their child sustains an injury?
Well, Mindy, I'm wondering if the question is, how long should that process of recovery take? And so I apologize if that's not the answer you're looking for, but most kids, and even for that matter, most adults are probably going to recover within a matter of a couple of weeks. Maybe out to 2 to 4 weeks, and it really depends on the person. It's so individual, and that's going to represent about 85 to 90%. But then there is that population of 10 to 15% that can go for months or even years trying to recover. And at this point, one of the things that we as researchers and as clinicians are trying to do is trying to figure out, okay, who are those people? What can we do to identify who those 10 to 15% are, and what can we do about it early on to help them recover just as fast as everyone else?
All right, thank you. We have another question that just came in. Should a parent keep their child from extreme and contact sports to prevent concussion?
That's a very individual parental decision, and what we usually say to parents is you've got to know the child, what are their physical capabilities, what's their level of physical maturation, their level of psychological maturation too. Are they ready for sport X, Y, or Z? There are many, many benefits to participating in sport that probably in most cases outweigh the risk of concussion. I think we're seeing about 10% of all athletes per year roughly will sustain a concussion. We have to be careful that we don't swing the pendulum too far back and overreact. As Dr. Vargas nicely noted, roughly 90% of people recover completely within several days to weeks after this injury. As we do talks with athletic trainers, for example, and if you ask large groups if they would rather have a concussion or an ACL tear, for example, most of the athletic trainers I've talked to would say, oh my gosh, give me a concussion because I know I'm going to be better within a week or two. And the ACL tear, that's months of rehab. 20 years ago we didn't know much about concussion. Now we do, and we know that most people recover quite normally and naturally.
And is there long-term damage associated with that at all?
Well, that's a great question too. It appears the answer is probably no for the vast majority of individuals. There might be a subset that for genetic or other reasons might have some additional risk factors for longer term effects, but that's one of the things we're studying, and it really needs a lot more research.
Okay, well, speaking of research, we actually have another question from Kristen. She's asking, what is context and what does the study aim to do?
I'm gonna let you take that one.
All right. So context is concussion in Texas. It actually has several arms to it. The local arm is we got several clinics in the area that are contributing data, ages 5 to I think 85 now. We've got about 1,800 people enrolled, and they undergo some interviews with our research coordinators, and we're trying to learn more about these factors that may help predict and identify people who are at risk for longer-term symptom durations. There's also a context statewide study that we've got going with the University Interscholastic League now, where we're trying to capture really a number of concussions that are happening all over the state and kids participating in UIL sanctioned sports. And in fact, the 6A schools, it's now mandated for them this fall to report concussions to us. So our goal is to get a handle on and an idea about how many concussions are occurring, So then we can actually look at what are best practices by region, what are the impact of rule changes, equipment changes in reducing concussion also. So it's all about player safety. We just need the schools to sign up and contribute data.
And what have been some of the trends with concussions over the last several years?
I think probably the biggest trend that comes to mind right now is the shift more towards an active rehabilitation approach than what we used to call cocoon therapy, right? In the past, there used to be a belief that after someone has a concussion, that you just put them in a dark room and you keep them away from their phones, their computers, their friends, from physical activity, and from school. And I think what we've realized over time is that that's exactly the wrong approach, and that tends to create more problems than it actually fixes. And so, my philosophy for a long time has been that we really should approach these the way we approach other sports injuries, and that is of an active rehabilitation program that's safe and monitored. So for instance, there have been a lot of literature lately that have supported the use of a stepwise return to play protocol and a return to school plan, and really engaging people in physical activity, not only just to monitor how they're progressing, but also because that's a very that enhances the rehabilitation process.
So you talk about returning to activity after a concussion. I'm curious, I've heard that you shouldn't go to sleep if you think you have a concussion or anything like that. So what are your thoughts on that? Is that pretty standard?
Well, that's one of the classics. I'm not sure what the term would be for it now. In the old days, we used to call them an old wives' tale. Don't wake them up. Well, what will you do if you keep waking them up? You're going to have a really irritable person the next morning who hasn't slept well, then they're sleep deprived, irritable. You're probably going to be then seeing symptoms that you might have accidentally induced based on waking them up a lot. Unless there's some focal neurologic reason, I'll let Dr. Vargas talk about that more. In general, let them sleep.
I totally agree. Not much to add to that. That really is a myth that still we see to this day even. And as Dr. Cullum pointed out, really what's going to be important is new neurologic signs or symptoms, or focal neurologic signs or symptoms that would warrant a visit to the emergency department. And if those aren't occurring, then we can let people sleep through the night, and that also helps them recover.
Is there anything that people can do to make their recovery quicker, or just play a more active role in that?
Well, that's a great question. There's a lot of research going on about that. As Dr. Vargas mentioned, it used to be total rest, take the cell phones away and everything, no screen time. What we advise is reduction in some of those stimulating things early on, but a fairly quick return to normal activities. So actually even some light exercise early on after the injury, as long as it doesn't worsen symptoms or elicit new ones. If that happens, then what we do, we back off, then you stop doing that. So if reading initially makes my headache worse, okay, don't read that day. The next day, try it again. If then there's no headache, then go ahead and read a little bit further, see how far you can get.
Yeah, I completely agree. I mean, that really speaks to the point earlier about the active rehabilitation process, and the fact that exercise is really just good for people in general, and it's good for people with concussion. And again, I can't emphasize enough the fact that we're talking about a low level to start, and ideally it would be with someone, either an athletic trainer or a physical therapist, anyone who is good at gauging symptoms and physical activity to help guide that process along.
Okay, well, we have another question from the audience. Kristen's asking, will Context roll out to 5A and other schools smaller than 6A?
So actually, Context is open to all UIL participating schools, and we are encouraging, as is the UIL, all schools to get on board and start contributing data. We've got a number of lower level, other level schools already contributing data, but it's voluntary for them. So we're hoping that the 6A mandate will trickle down and other schools will also start participating as well, because we should have really good data on 6A in a year from now, and we definitely want to build that in the other schools as much as possible. So it's open to all UIL participating schools. So if anybody has questions about that, they can Google contacts and look at the UT Southwestern website and learn more about the project and how to get their schools involved.
Okay. So if someone sustains a concussion, or if they think they have, can they go to their family doctor, or should they see a specialist?
Well, you know, again, going back to that earlier point that the overwhelming number of concussions just end very well, right? People recover nicely within a few days to a couple of weeks. That really speaks to the fact that most people can probably see their primary physician or pediatrician, and outcomes will still be good. There are that small population of people that have symptoms that are really prolonged or even really disabling for them, that probably should get directed to a specialist early on, so we can intervene with any one of a number of things. But I think your general your general athlete who has a concussion that seems to be recovering along a normal trajectory, those can be handled by most people, by most healthcare providers, that is.
Okay. We received a private message, and they're asking, what are some activities that you wouldn't normally associate with a concussion?
Well, immediately what comes to mind are a couple of collegiate athletes that I've seen that were swimmers. So I saw in one season when I was back in Arizona, I saw more concussions in the swimmers than I did in the football players, right? And then I've seen a couple of very bizarre, just freak events that occurred in a cross country runner. So, you know, if anything, that's really that really speaks to the fact that concussion happens, right? I mean, just the sheer act of us being physically active beings leaves us susceptible to concussion. So it's not a problem that we just see with contact sports, but it can happen doing anything, including routine daily activities.
In fact, if you look at the CDC, ER reports to the emergency room, falling off bicycles is the number one cause of concussion in kids under age 20. So no one's immune or from being at risk of concussion, if you will, if you're walking around. Trips and falls are common causes. As far as some of the sports ones, we've seen marching band, somebody tripped and fell. There's a golf injury is in our database, again related to a fall or getting hit with something in baseball. Cheerleading is actually one of the higher risks activities for some of our young adolescent females too.
Cheerleading, I think, doesn't get much respect as far as being a sport, which it definitely is, and being a sport that carries with it some risk for concussion. So I'm glad we're collecting those.
Yeah, that's really interesting. I just wouldn't have thought of that. We have another question from Narelle. She's asking, may I ask, what about missed concussion diagnosis? Are there symptoms that can trickle over time, for example, a few months after an accident? I guess what was the question there?
So so the answer is yes. That the symptoms that we associate with concussion don't always happen immediately at the time of injury. And even though for the most part we see those symptoms develop over perhaps hours to days, that would be the more usual time frame. It is possible or conceivable that someone could have some low-level symptoms that perhaps they don't quite notice or just don't recognize as being concussion symptoms that finally reach a point weeks to months later that then it gets their attention. I think that's the more likely scenario.
Okay. We have another question from Armin. Asking, is there any correlation between children's mental health and rigorous types of contact sports? Inflammatory markers, IL-6, TNF-alpha, etc. are shown to decrease when people exercise. Would this result in better mental health for the students?
Exercise is good for everybody, and certainly there have been studies showing that increasing blood flow to the brain is a good thing for all of us at all ages, quite honestly.
Okay. Well, we have a question now from Jenny. She's asking, how is the UIL communicating this new rule to schools, coaches, athletic directors, and parents and students?
Oh, they've already sent out emails and flyers through the mail. They've announced it at some of the larger UIL coaches meetings also. So all the schools should know about it.
All right, well, it sounds like there's a lot of preventative work going on. What else have I not asked you, or has our audience not asked you that they should know?
Wow. Let's see. Yeah, anything that comes to mind?
Well, the one that comes to
Kind
mind.
of a loaded question.
The one that comes to my mind that we often get asked is people assume that you have to be knocked out to have a concussion.
That's a good one.
And actually, if you look across multiple databases, including our own context studies, it's only about 10% of people with concussion are actually suffer a visible loss of consciousness. So you don't have to be knocked out to have a concussion. That's another one of the popular myths.
Yeah, I going back to one of the things we discussed earlier about CTs and MRIs. I know one of the questions that I get a lot in clinic is, well, are you going to order an MRI? Are you going to order a CT? And this is assuming I'm working with a child that doesn't have any sort of focal neurologic deficits that point to a specific lesion that we might be able to find. And this is where that education comes in, that what we're dealing with are disruptions that are at a cellular level that are there. You could, if we had the capacity to see that at that level, we would. But MRI, your standard MRI is just not equipped to find those minute problems. So that's why we don't order them as much as I think some people would like. But that's also why they come back normal so frequently, and why I'm left with the task sometimes of explaining to someone why their MRI is normal when they clearly don't feel normal.
That's really interesting. I wouldn't think an MRI would miss that. So
That's a common belief, or the question we get is, well, aren't you got to get a CAT scan, right? Mm-hmm. Well, if there's a focal sign, if there's evidence of something might suggest a bleed or some intracranial abnormality, specific, structurally large, yes. But in the majority of cases, there's not intracranial bleeding that we can see. There's not a focal neurologic sign in the majority, in the routine cases. And so a CT or MRI is really not going to show anything in most of these cases.
I think. I'm sorry. I was going to say. I think one of the other things that I love to discuss with people, and I know Dr. Cullum will probably be able to expand on this a little bit, is the use of concussion tools, and people feeling like, for instance, their child took an impact test and they passed it, and that they should be fine, or even that they didn't pass it and they definitely had a concussion, because we've seen both sides of this. And really, the message that I try and get out is that those things are really tools. At this point, there is no tool that makes the diagnosis. It's still a clinical diagnosis that requires someone who knows about concussion to put all those tools together and sort through all the all the facts and the noise and all that other stuff to come up with a diagnosis. So we don't rely on any one tool alone to make the decision for us.
All right, well, we have just one more question and then we'll wrap up. This is from Jaron asking, how can the eyes help determine if there might be a concussion?
We have an expert on oculomotor movements right here. So
yeah, so that's a really great question. I'll see if I can sum it up real quick. But the fast version of this is the pathways that are involved with eye movement and processing of vision really traverse a very large amount of real estate in the brain. And that's why when you have damage or injuries to any one of a number of areas, sometimes you can see maybe even very subtle changes in eye movement or in the way that someone processes vision. And so I think more and more we're seeing that people are developing tools that look at specific eye movement abnormalities that can help detect when someone's neurologic function is not normal. And again, going back to the point I made earlier about tools, the fact that it appears normal according to that test or it doesn't appear normal to that test, it's really just meant to give us information, which we then use to put together with a good physical exam and a good history to determine what happened to that athlete or that person. So we're still not at the point yet where we have a tool that can detect an eye movement abnormality and tell us with any definitive conclusion, concussion or no concussion. But I completely agree that I think the eyes have a lot of information to tell us about someone's neurologic health.
All right, well, thank you both for joining us, and this chat will be available later on YouTube and Facebook if you need to come back to reference it. Thank you to our audience for all of your great questions, and we will see you next time.
Right.